So someone with, let's say, a mild asthma, and they get like symptoms every now and again, would you put them on the long-acting beta agonist, the short-acting one, and inhaled corticosteroid?
Okay, so you're really asking me how do we use the treatments?
Yes.
And so it depends on the classification of asthma. So
Yes.
when we think about asthma, we think about those who have very occasional symptoms like we spoke about. Asthma, where the chest closes every now and again, once a week, once in 2 weeks. Those patients can just use a short-acting beta agonist,
Okay.
like Ventolin. So we would call that intermittent asthma.
Okay.
If the wheezing is more frequent, then that would be titled chronic asthma, and then that would be mild, moderate, and severe, depending on how many symptoms they have during the day, how much of symptoms they have at night, their ability to go to school and do their work, etc. So again, in the intermittent asthma, they can just use a Ventolin or salbutamol pump. If they've got more chronic, persistent symptoms, then they need to be on both a bronchodilator and an inhaled steroid.
Okay.
And if the symptoms are more severe in this chronic group, then from the short-acting bronchodilators, we'll move to the long-acting bronchodilators. And from the low-dose inhaled steroid, we would move to medium and high doses of inhaled steroid.
Okay.
So we tailor the treatment for the severity.
Yeah.
The more severe the symptoms, the more treatment, the more sustained the treatment needs to be. That's why we give a long-acting bronchodilator, so the chest is open the whole day. And we need more potent and higher doses of inhaled steroids to block the more severe inflammation in these patients.
Okay. All right. I think I understand now. What else did I want to ask you? I wanted to ask you about the patients that do come in with acute exacerbations of asthma. How is the hospital and what is the hospital doing, like, to make sure this doesn't happen again? Do you get like free treatment, or how does it work?
So the way the hospitals and the district hospitals work is that treatment is based on income. And for most of our patients who do not earn high salaries, they're either free or pay a nominal fee.
Okay.
So we're very fortunate in that respect.
Okay.
But you're talking about prevention.
Yes.
And the answer is that any patient can attend any facility in South Africa. But all the severe ones tend to come to this hospital, and then they usually refer to me in my clinic. And thereafter I do an assessment, and I put them on proper doses of preventative treatment to make sure that they're properly controlled. And then I monitor them usually for a minimum of 1 year. And then I send them back to their district hospitals with a treatment plan so that it doesn't happen again.
Wow. This all sounded amazing when I was reading it, but I still feel like a lot of people are either like on the long-acting alone, or they're just taking random asthma pumps, or they don't know how to use it. So what are we doing to target, and where is the main problem? Is it by the district hospitals, or like, do we have to go to schools and do patient education? Or, what do you think could make a difference?
And the answer is, unfortunately,
no.
that in all of medicine, for all the chronic diseases, one has to develop a partnership with the patient, and there has to be continuing education of doctors, which is why we had to update the guidelines so that doctors could be informed. So we are constantly involved in continuing medical education activities to inform the doctors about what are the proper standards of care, and which is why we train the students to use the treatment appropriately. But you're right, we do go to these clinics and we educate the doctors and nurses there. But that's one component. As I said, with all chronic diseases, one has to develop a partnership with the patient, because we have to ensure that they're compliant and that they trust us and believe in what we're talking about. for their health. So education is very important, and it's something I do on a daily basis, because there has to be reinforcement as well. You're absolutely right that there are a number of errors that creep in. People don't understand the different types of inhalers and what the medication has and how they work. And it's a constant re-education and re-emphasizing how to use the medication. The one very important and simple aspect of asthma I have to mention, although I talk about the disease and I talk about the inhalers, proper use of the inhalers cannot be overemphasized. Most people I meet have never been taught how to use an inhaler.
But they have one.
But of course they have one, you're right. So it's been prescribed, it's been dispensed, they go to the chemist, they pick it up, and then they get the strange device. And I mean, it might be slightly strange to medical students. Can you imagine how strange it is to poor patients? And I can assure you, you will be astonished to hear that the vast majority of patients haven't been told how to use an inhaler. Yeah. I saw a patient at the clinic this week. She's got asthma for 15 years. She said this was the first time that somebody had checked how she used the inhaler and had corrected her use. So the important point is about the inhaler is correct usage and to retain the medicine within the lungs. So after you've shaken the inhaler and breathed it in, you've got to hold your breath for 10 seconds to allow the medication to settle in the airways and have an effect. Most patients breathe out immediately, and then all the medication that they've just taken in is now in the room around them, and they can't understand why they're still sick. Yes. So it's unlike a tablet. You take a tablet, you swallow it, it gets into your blood, it is in your body. But asthma is different. The medication has to stay in the airways. And if we breathe badly and breathe all the medication out, then there's nothing in the lung and patients will be uncontrolled.
You heard it, folks. Use your asthma pumps properly.
Okay, thank you.
Thank you so much.